In today's episode, I'll be talking to holistic dentist and co-founder of MYOSPOTS, Dr. Shehab Faragallah, about the vital importance of nasal breathing, as well as how the alignment of your tongue can affect your sleep, your posture, your energy levels, and your facial structure. This guy absolutely blew my mind, and I know he's going to blow yours too. I really hope you enjoy the episode. If you haven't already, don't forget to like, share, and subscribe. Let's keep building that breathing community and spreading awareness of the power of the breath. All right, let's jump right in with the conversation. I think you're really going to enjoy it. This is episode 2 of Just Breathe with Dr. Shehab. Hello, Shehab, and welcome to the Just Breathe podcast. It's so good to have you here. How are you doing?
Good. Thank you for having me.
Thank you. Awesome. So would you mind just telling the Just Breathe listeners a little bit about yourself? I know we've talked a bit before, but I'd love you to introduce yourself and just tell everyone what you're about.
Okay, well, so by profession, I'm a dentist, and I spent a lot of my time as a general dentist. I've owned a practice before, but then sold that, became a bit of a freelance dentist, then got introduced to holistic dentistry. And after that, I got heavily involved into myofunctional therapy and breathing. And I spend most of my time now teaching children how to breathe, how to position their tongue, and teaching them how to swallow, and just trying to understand the importance of muscle balance and breathing for children and adults as well.
Right.
So that's basically where I'm at the moment.
Yeah. This word myotherapy, I know, comes up a lot when I was listening to sort of other podcast episodes you've done and sort of looking into what you do and things. So could you explain to everyone exactly what myotherapy is and what that means?
Yeah, sure. Myotherapy, the word myo is from muscle and therapy. So it's like muscle therapy, but it's been adapted really closely in the dental and well, speech pathologists as well, to mean anything to do with the tongue and facial muscles, and therapy for that. So if you were to speak about an oral myologist, for instance, the word oral is obviously like to do with mouth, and myology being muscles of the face and tongue.
Yeah.
So it's basically trying to create balance of muscles in the face and tongue for normal activities, which include swallowing, eating, talking, and all those kind of things. So we're trying to get the muscles to work the way they should. And some muscles in the general public are overworking, and that's a problem. That can cause a lot of problems. And some muscles are underworking. So if you've got that big imbalance, then it can create a whole bunch of distortions and growth issues in children and adults.
Right. And that brings us quite beautifully actually onto MYOSPOTS, which I'm sure we're going to talk a lot more about later, but I did just want to briefly mention straight away in the podcast, I've got some right here. I have one in my mouth right now. My one is blueberry and it tastes fantastic. But of course, your thing is tongue alignment, right? And the importance of tongue alignment for correct optimal breathing and for correct facial structure. Is that correct? Or please correct me if I'm wrong.
Well, the tongue is such a powerful muscle.
Yeah.
And, there's more to the tongue than just talking and eating. There's a natural resting posture of the tongue that we all should have. And if you think about, there are a lot of muscles in the body that have a core position and strength. And, everybody knows about when they do Pilates, they try to get their waist nice and strong, and that's considered like a core muscle there. And, there's a terminology out there where your core is weak. You automatically assume that the muscles around the waist they're not quite right, they're not strong enough. And you often go to therapists, even occupational therapists for children that slouch a lot, and that because they might not do well at school because their posture is not good, and that makes them slouch. And the moment they start sitting properly, they are able to concentrate better, and it follows on from there.
Right. It's also interconnected, right? Body, mind, how your posture is correlates completely with your mood a lot, right? And your attention span and your state of mind.
They're all interconnected. And the thing is, when we talk about the tongue posture, it's similar to the posture in the waist.
Right.
That tongue needs to be doing something specific all the time. And there needs to be a little bit of sort of subtle contraction all the time. And what happens is that when the tongue becomes flaccid and it sort of just sits low, then you're not achieving the benefits that you should from a good tongue posture. So the tongue should really sit up in the roof of your mouth. It should be about 2 to 3 mils. The tip of your tongue should be about 2 to 3 mils behind your front 2 teeth.
Right.
And there is a spot that a lot of therapists use to identify where the tip of the tongue is. And that's when you pronounce the letter N and you hold on it. So it's a bit like saying yes, like that. N. And that's where the tip of your tongue is, right?
Yeah, right.
And that's where it should always be.
Right.
But more so than that, that's just the tip. So if you think of the tongue as a vehicle and the steering wheel is the tip of your tongue, well, the rest of the tongue has to go up as well. Right. And that's the back part of the tongue. So once you've got the tip in the correct position, then you can rest the back part of your tongue. Yeah. And when you do that, the whole base of your mouth lifts up to the roof of your mouth. And that's really important. It has so many health benefits.
Right.
And functional benefits as well. So that's what we talk about when we talk about tongue posture.
Gotcha. So, I mean, then the next question is, of course, what does all this have to do with breathing? Why is where our tongue is placed in our mouths, why does that have such a profound effect on breathing? Why does it matter?
Well, it's a good question, because the most important thing with breathing that I feel is that we should all be breathing through our nose. Our nose is designed for breathing. It's got like filtration, it's got air purification, it warms, humidifies. You know, there are other benefits it introduces in the paranasal sinuses. It introduces nitric oxide, which gets released, and that's important for breathing. There's so many, I'm sure you know about all the benefits, but one of the things is that when you breathe through your nose, when your tongue is elevated, it automatically brings the musculature of the chin up to the roof of your mouth and actually creates a habit of bringing your lips together. So it kind of forces you to breathe through your nose. Right. So that's the first thing. It creates an anatomical change that favors nasal breathing. Right. And that's one of the very first things it does. Aside from that, there are soft tissues in your mouth. For instance, the soft palate. When the tongue is elevated, the position of your soft palate changes favorably to open up the airway at the back of your throat as well. Right. So you actually get improvement in the patency of the airway from your nose down towards the back of your throat when your tongue is elevated. So it facilitates a better nasal patent airway when your tongue is positioned correctly. And that's what I think is one of the key things that a lot of people they look at nasal breathing without looking at the tongue posture. And it's possible. You can be a great nasal breather and not have your tongue positioned, but why not reap the extra benefits of having your tongue elevated and improve the patency of your nasal airway? And that's what tends to happen. So just by lifting your tongue up, and that's what MYOSPOTS does. It actually adheres. I'm sure you've tried. You've got one in. So you've got once your tongue is up the roof of your mouth, then you're creating that habit, and that's the difficulty, because you can tell someone to raise their tongue to the roof of your mouth, and some people can do it. They will. They'll just start doing it. But there's a lot of people that, especially in children as well, that find it difficult to create the habit of always keeping their tongue elevated and touching the roof of the mouth. And that's what becomes quite difficult. So when you use that regularly, then over a period of time, your tongue starts to lift in that area where it should really lift.
Right.
So that's how it connects to breathing. But there's a whole bunch of other health benefits as well that the tongue has. So,
yeah, that's incredible as well to think about that. If something as small as an adjustment as adjusting the tongue can change the way you breathe and really help to encourage nasal breathing, then that in turn will have a knock-on effect on everything else, surely, in terms that if you're breathing correctly, of course. And I've learned from the Oxygen Advantage, and I know you have some experience with the potato method as well. Which I'd love to hear more about as well. But it is interesting, isn't it, that when we're breathing correctly, suddenly we're sleeping better, we're having a lot more energy. You'll see that you have a more vibrant glow about yourself. I noticed when I switched my breathing, I definitely used to be a mouth breather and switched to nasal breathing. My skin was so much better. I was craving actually better foods, and I was sleeping a lot deeper. My fitness levels have gone up. So it's not just about the tongue itself, is it? Or about even just to correct your breathing. It actually has a knock-on effect on your day-to-day life. And so the effect this could have with children is something that is absolutely profound to me, that just by putting a little tiny thing that looks like a sweet to them on the roof of their mouth could actually improve focus in school, and could improve sleep. And I think that would mean a lot to an awful lot of parents out there.
Yeah, 100% right. I mean, getting that tongue positioned in the roof of your mouth for children, I mean, a lot of children habitually breathe through their mouth.
Right.
And it just becomes a habit. And the reason they habitually breathe, they may have had, one of the most common reasons with children, especially breathing through their mouth, is that they may have allergic rhinitis, where they get stuffy in the nose, or they might have inflamed tonsils or adenoids. They, to be honest, that's the most common causes of blockages in the nasal airway.
Right.
And then what happens is that they'll start breathing through their mouth. Now, what can happen is that at some time they may have seen an ENT and they may have removed the blockages, or they may have, for instance, the things that are causing the allergens are no longer there, and their nose is starting to function a bit better, and sometimes they grow out of it, but they maintain the habitual mouth breathing. And if they're not, and a lot of these children, if they don't make a conscious effort to start breathing through their nose, they'll maintain that habitual mouth breathing.
Right.
And that's where it's really important to redirect people to start learning how to breathe through their nose.
Right.
And it takes some training. And like you would have noticed yourself, like it took a conscious effort for you to change your breathing.
Oh, yeah.
And once you started to do that, then you started to reap the benefits. But before you actually did that, then you would have noticed that it may have been a bit difficult.
100%.
So it takes time. And that's where with MYOSPOTS, it is just simply a tool to help people create the habit of breathing through their nose. And then if they can do it without it, then great. But it's just a tool. Yeah. At the end of the day, a lot of what is functional medicine and holistic medicine and dentistry or allied health, it's all got to do with assisting the body to heal itself.
Right.
Rather than, like the majority of medicine these days, has got to do with, taking some form of medication or tablets and things like that.
Right.
Whereas the other approach is to look at lifestyle, and medicine does that great as well, but it needs to be advocated, I feel, a bit more. So improving your diet, improving, doing more exercise, learning to sleep, have better sleep hygiene, for instance, and breathing. Learning how to breathe properly.
And that's the one that gets missed out, right? All the time. Everyone talks about diet and exercise, but no one, but considerably less people are talking about breathing. And we're not just talking about children here. And I assume as well, MYOSPOTS aren't just for kids, right?
No, adults and children. Yes, that's right. Yeah.
They're for everyone. Yeah.
It's for everyone. Look, I think the reason it's so, the reason I think it's so overlooked is probably because it's not an easy one to see. So like if somebody's over like eating bad, I mean, you could sit down in a burger shop and you know, you could say, okay, that guy there or that lady there is having a bad day of eating today.
Right.
And you can visually see that.
Yeah.
Or, you know, you can see that. And then, or you can see someone else, for instance, who's lives a very sedentary lifestyle. You know, they might be overweight or whatever, and they don't exercise. And you can actually see that. With breathing, it's a lot more subtle because you only need to open your mouth by a few millimeters to be a habitual mouth breather, and it's very difficult to see. So unless you're specifically looking out for it. For myself, I can tell pretty quickly if somebody's a mouth breather or a nasal breather. Most of the time.
How can you tell?
Instances,
what do you know? Of course, if their mouth is open.
That's the first sign. And sometimes, like especially you see in the elderly, their mouth is not open by very much. And, you know, mouth breathing is accompanied normally with poor posture, because generally speaking, when your mouth opens, your chin goes forward to open up and your tongue sort of comes forward a bit more as well. So you see like a bit of postural changes, like with the shoulder slouching and things like that. The mouth breathing, of course, is accompanied by poor tongue posture. Because once you've got that tongue, especially the back part of your tongue up in the roof of your mouth, it's difficult to maintain poor posture. Your posture improves the moment the tip of your tongue is in the right spot and the back. Then what happens is that your posture automatically improves because
it lifts, right?
That's right. You're kind of like, you imagine like on the inside you've got some kind of crane that's pushing you up, or jack or car jack that's pushing you up in the middle of your head. I mean, the back of your throat is only like a very small distance apart from your vertebrae. If you look at a CT scan or an MRI, you can see that the vertebrae are there, and then you can see in front of it, you can see the air pipe and the esophagus, and you can see how close they are. They're very close to one another. So when your tongue lifts up, that whole structure lifts up, and it tilts your head, and you're able to breathe a lot better through like a straight airway rather than it sort of being like curved and from front to back. So it makes a big difference. And the other thing is you see like dry lips, you know, that's another one, cracks in your lips.
Do you know, I always had dry lips as a child. My lips actually used to bleed in the winter when I was a child.
Yeah.
It was so
Were you one of those ones, do you put a lot of like...
Oh my goodness, you know, the Vaseline, and my mum would just like kind of smear it across just the bottom half of my face just to be sure.
Just to be sure that it's there.
But it was painful. They were so dry, and I used to wake up with a dry mouth every morning up until the age of about 23. I'm 25 now. So for 23 years, I was waking up with a very dry mouth in the morning, not hardly being able to speak. And now I know because I was sleeping with my mouth wide open, and I'm sure that probably contributed to my dry lips as well. It also took me a very long time to sort of get going in the morning. As a child, I was never a morning person. It was like, don't speak to me until 11 a.m. kind of thing, you know, whereas now I've made the switch. I'll wake up at 6 a.m. and be sprightly because my mouth feels moist. I can talk straight away. And that's from using something called sleep tape, which is, I'm sure you know a lot about, which is also to encourage nasal breathing while you're sleeping. And it's really revolutionized my sleep. And it's something Patrick McKeown from the Oxygen Advantage really encourages as well. And all
Yeah, they're great. Like those extra things you do, they're fantastic. And, you know, I advocate sleep taping your mouth when you sleep as well, especially to create a habit of nasal breathing. What I normally tell people is to try and wear the tape, you know, every day for a few months. And then I cut them back to a couple of times a week where they audit themselves to make sure that the tape is there in the morning. Because what happens is a lot of times people tear it off in the middle of the night. And they just throw it away. So if it's still there, I'm talking about the tape that just goes from here.
Tiny piece. Yeah. Yeah, I've had that
right
before
underneath your
too.
lips, yeah.
I've
So
had that.
a little bit of tape,
Yeah.
yeah.
I've had that where I advise
Have you torn it
people
off and
to
done that?
use, I've had that where I advise people to use
Yeah.
sleep tape, and I was like, even just a little bit of pharmaceutical tape, like that sticky
Yeah,
paper
that's
tape.
right. Just a
It's
little
like,
bit of
just cut a
microfiber.
tiny bit on there, and they'll send me a picture, and they've literally almost wrapped it from
Yeah,
one ear to the other. And it's
Yeah,
like,
yeah.
no, you just need a tiny, tiny bit. But it's quite an intimidating thought for a lot of people. It freaks a lot of people out at first, doesn't it? Putting spots on the roof of your mouth, putting tape on your mouth. But
Yeah.
you're right, it is subtle changes. And from what you were saying before with the posture thing, I just wanted to bring that back up. I had this mental image of someone going for a run, and if their posture, their head is leant right forward, and then they're putting stress on the body by exercising, they're putting themselves there at risk of injury, right? They're putting themselves at risk of a really sore neck whilst they're at rest. So this is crazy that people possibly don't even have a knowledge or are even aware that a tongue being misaligned could be causing all this. They'll spend hundreds on chiropractors and things, right? When actually they could change the position of their tongue. It could potentially have a huge effect, right?
It could have a massive effect. And like when you're talking about like joggers and runners and things like that, have you had a look at some of the marathon runners out there? And you know, when you see like the best marathon runners, they're all got their lips closed. And I mean, you know, you look at
amazing
some of the
nose breathers, right?
Olympics, yeah, oh my God. So, and they do that for a very long time.
Right.
Now, if you're a mouth breather, it's very, very difficult to maintain that. Now, it's kind of like you're burning double the fuel and you're getting a lot less out of it. So you're overworking your system to achieve a result that you can use half the amount of air, and so you're over breathing, and the paradox is that you may even be less oxygenated, because what happens is that when you breathe through your nose, it encourages all those blood vessels around your lungs and things like that to open up with water nitric oxide.
Dilate, right?
To dilate, right? And now you're not getting that. And like I'm sure if you've spoken to Patrick McKeown, he would have spoken about the Buteyko, you know, the effect it has when you've got too much oxygen, and the hemoglobin becomes a bit more sticky to the oxygen not releasing. And I mean, there are a lot of physiological effects that it has. And so nasal breathing has a huge impact. And so
100%.
Combine that with the tongue posture, then that's the way. I think that's how we're designed to be. We're designed to have our lips closed, designed to have our nose functioning as a mechanism of taking air in and out. And if you do it any other way, we're just not as efficient anymore.
100%. Yeah. For the listeners, I'd love to quickly touch on if anyone is lost when we're talking about too much oxygen, the idea of over breathing. Just to reiterate that, of course, if we're over breathing, you're exhaling too much carbon dioxide, and then it's almost like, I like to say that carbon dioxide is like the divorce lawyer between oxygen and hemoglobin, and that it just separates it and allows that oxygen to actually get where it needs to go and move on and get to the muscles and things. And would you like to explain a little bit more just about overbreathing and what we're actually talking about when we're saying overbreathing?
Yeah, for sure. I think like overbreathing is what I would say similar to overeating.
Yes.
And when you like anything, you know, in life, anything in excess can be harmful.
Right.
I mean, like, except for maybe the exception of love, maybe. But even then, that could be, you know,
you can definitely have too much love.
Yeah, you could, you know. But you want to try. Anything in excess is harmful, right? You'd agree with that?
Yeah,
so,
100%. Actually, I was listening to a training with Patrick from the Oxygen Advantage yesterday, and he was talking about apples, and he said you eat 1 apple and it's great. You eat 2, it's okay. 3, you're a bit bored now, and 4, you feel sick. And it's the same with over breathing, right?
That's right. Yeah.
It's just in excess of your metabolic needs. That's basically the
right.
explanation of overbreathing, is you're breathing in excess of your metabolic requirements. So it's different for every single person. You can't, it's not mathematical. You can't match it to each person. But if there's different things you can see the signs of, right? If you're waking up with a dry mouth in the morning, if you have cold hands and feet, if you have lower energy levels, possibly could be a sign that you're overbreathing.
100%. I mean, like, you know, the moment you start breathing through your mouth, you're more prone to gum disease, you're more prone to getting tooth decay, you're going to have bad breath, you'll have, like, you know, stains on your front teeth, you're more prone to getting sick because you're not getting the filtration through your nose.
And how relevant is that right now, right? With the global pandemic on our hands.
100%. I read an article recently that the first line of defense for airborne viruses is nasal breathing. And that includes the pandemic, right? So you're wearing a mask, you want to be breathing through your nose while you're wearing that mask. You don't want to be mouth breathing. And that's your first line of defense. And that should be something that we should all do. So if you wash your hands, you keep your hands nice and clean, and you nasal breathe, then you're better off. You're better off than somebody who's, people who mouth breathe tend to get ill quicker. And that's something that you want to be able to sort of take control of in a situation like this anyway.
It blows my mind. It's so simple too, and it's so
simple.
And with children going back to school and different things like that as well, and not just children, anyone of any age, to have that barrier of protection without having to pop a pill, without having to spend any money, even visit a doctor. You can do it at home anywhere in the world. It's almost quite an empowering thought, isn't it? That you actually have that tool within you, that life can be a little bit easier if you have the knowledge. It's all about knowledge, perhaps. Do you agree? What do you think?
Well, 100%. Like, you look at people's faces. Sometimes
I was just about to get onto this facial structure. I was just going to say, I'm so fascinated with all your information on facial structure. So I'm going to please carry on. I'm really excited.
Well, before I get into the mouth, especially, I was going to talk about just the nose, its position in your head. You know, it's right center, right there between your eyes, above your mouth. It's the centerpiece of you.
Yes.
And
the chandelier.
It is. It's like the icing on the cake, right? It's right there.
It is.
And what other purpose should it have if it's not for breathing? It's there, isn't it?
Right.
So if we don't use it to breathe, then what else is it? It's not there just to look good. It's there for a purpose, and that is to breathe. And that's why you've got two nostrils there. And that's why at the back of your nostrils, you've got turbinates that you know, they create turbulence. That's why they're turbulence, and that's why you've got cilia on the inside of your nose. So you've got all these like little structures that are there.
That air resistance, right? Slowing down.
Right? They slow the air. They make it like they turn it into like a little misty cloud, preparing it for your lungs.
Right. And the mouth does none of that, right? The mouth does none of it.
And the reason the mouth does none of that is because it's not designed for that.
Right.
So that's, I mean, from a structural point of view, it's there, and you're asking, you ask the question, well, why don't people know? I think sometimes when things are so obvious, we just ignore them.
In this world, right, we're overloaded with so many complications, the most intricate of technologies, the craziest of things are coming up every single day, and yet something as simple as breathing, you almost brush it off because you're like, nah,
brush it off.
I know that already. I remember actually, he's going to be really annoyed at me maybe if he listens to this, but I was speaking to my granddad when I first got into breathing, and he was like, I've been breathing all my life, I'm fine. And that's such a common thing I hear from people, is that I don't need to work on my breathing. I've been breathing my whole life. There's nothing wrong with my breathing. And you're like, well
that's it. No, that's exactly it. And the thing is with a lot of the elderly, they actually end up creating this mouth breathing habit, and you see it all the time.
Right.
Where a lot of the elderly are walking around with their lips just apart, and they become such a habitual mouth breather.
Yeah.
And that's because somewhere along the line, they've picked up the habit and they haven't put it back down. And that's a problem.
Right.
But then every now and then you see like habitual nasal breathers, people in their 80s. My dad's a good example. and he's got amazing facial structure. And he grew up in a really in the farmlands of Egypt. And you look at his face and you go, wow, this guy's actually eating the right food and he's developed right. He's got nice nostrils.
Nice nostrils. That's... I really feel, breathing is hitting the mainstream. And soon on a first date, it's not going to be like you have beautiful eyes. It's going to be, hey, I love your nostrils. You have amazing nostrils. You have a great face.
There's some good nostrils there. I bet you breathe quite well.
You breathe well.
Yeah. I bet this person sleeps quite well.
Yeah. But it's also, it is a very attractive trait, right? Because if you're a nasal breather, you're much less likely to snore. You're much less likely to suffer from obstructive sleep apnea. So really, you're a much more desirable partner if you're a nasal breather.
That's right. Exactly. And you're talking about the structures of your face and everything else. Well, the number of times I've seen patients and I've looked at the maxilla, which is the top bone here, and seen that it's really wide with plenty of space for the tongue, and their teeth are so straight and their cheekbone's in the right spot. And you look at the angle of the jaw, they've got like a really nice angle of the jaw, and this whole area looks great. And I asked the question, where's your tongue right now? And they go, well, it's sitting up the top. I go, great. And they go, isn't that where it should be? And I'm like, yeah, not everybody does that. He goes, not everybody does that. And they can't believe it. Because the ones that do that don't really understand how you can't not do that. And I haven't really noticed that people don't do that.
Right.
So those few people that were lucky enough to develop well, don't really get it, that there are others that don't have that habitual tongue elevation position.
That's insane.
And so it is.
Could I flip that over then to people that perhaps weren't so lucky, and I'm including myself in this group of people, that didn't develop with optimal breathing. I was definitely a habitual mouth breather as a child, and I had particularly wonky teeth. I have braces right now. People watching the video, you probably can't really see them. They're kind of the see-through ones, but they are the train track ones, and I'm so grateful for how they've aligned my teeth. And I actually think that's helped open up, you can probably tell me, opened up the back of my throat in terms of breathing. I just feel like I have more space in my mouth now my teeth are aligned. But talking about those people that didn't grow up with nasal breathing and correct tongue alignment, what effect can that have on your facial structure and how your face develops once you're an adult, and how malleable is that facial structure as you're growing and once you reach that adult age? Like, can you change it? Is there hope for people out there now that are sitting there going, no, I've been doing it wrong for all these years? Is there hope?
I'll answer that from back to front.
That was a long question, but
So is there hope? I would say yes, 100%.
Great.
I think that there is always, correct the soft tissue. Once you correct the soft tissue, you will immediately get benefits, because once the soft tissue is corrected, that means your lips come together, your tongue goes through your mouth, you start breathing through your nose. You're not using your facial muscles for ordinary swallowing movements, except for just keeping your lips together. For some people, they've got a lot of activity happening in all these muscles around their lips and chin, and every time they eat and swallow, you can see all the muscles pulling back and making things worse. And that extra muscular movement is because a lot to do with the position of their tongue and lips. And so once you correct the soft tissue, you do get benefits straight away.
Right.
And that includes, you could learn to breathe through your nose even with crooked teeth, as long as you've got patency through your nose. One way to test it is to see if you can hold water in your mouth for a couple of minutes.
Right.
So you just put a little bit of water in your mouth, lips together, and just time yourself. If you can hold that water for a couple of minutes, then it means that your nose works to a certain degree.
It's working.
Now, and if it's not working, if you can't get any air out or in or out, then you might need to see an ENT just to see if there's a blockage. You might have some traumatic blockages or something like that.
There's also nasal dilators you can get as well, right? That's also an option depending on the severity.
Well, yeah, I mean, I'm sure a lot of the Buteyko guys will teach you how to breathe even through really narrow nostrils.
Right.
But one of the issues that tends to happen is like, and this is more of the ENT sort of field, but the nostrils themselves, as you breathe in, they'll kind of close in on themselves.
Right.
And they'll kind of shut. So maybe that there is some kind of possibility to use these nasal dilators, but I don't know. It's one of those things where I believe the more you use your nose, the better it will get.
If you don't use it, you lose it, right?
That's right. Yeah. So if you keep on training yourself to use it, then you'll develop like some structure in being able to keeping the nose open.
Right.
I don't know 100% sure. I mean, it's not one of those things that I've looked in too much detail. But all the children that I've trained, after training them, they've become habitual nasal breathers. And
do you see a difference in their face, in the way their face is structured?
Yeah,
Wow.
absolutely. That takes once you've got the lips together. I mean, you look at a child with their mouth open and closed. They look different. They look different, right? Just looking at them, you can see like a child that opens their mouth. They look different, and that's just
kind of like this.
That's right, and usually the tongue stuff, yeah.
Yeah, sorry, for anyone listening to the audio, I've like put my chin forward and I'm kind of slouching, and instantly actually if I open my mouth, if I think of like my chin goes forward, I slouch.
Well, that's right, because as your tongue comes forward, it drags everything else forward with it. So it brings your head forward, and that's why when you put your tongue up, especially the back, it brings everything back to where it should be. It should be nice and straight. Right. So you do initially see the soft tissue changes, and I always say once you've got the soft tissue changes, then the face will follow, and it takes time. Wow. But you've got to keep your tongue up in the roof of your mouth. You've got to relax all the muscles around it. Sometimes you need to see an otolaryngologist to assist you in being able to relax those muscles around you. But there's a lot of information online these days on people that follow Mike Mew, and he taught mewing, and these guys, they've empowered themselves, and you see them like doing before and after photos within like a couple of years apart. Yeah, and you see amazing changes, and all they're doing is that they're breathing through the nose. They've got their tongue elevated through the mouth always, and they chew a lot, and they chew hard things, and they chew a lot. And that develops their mouths. And when they do chew, they keep their mouths, the lips together. And they sleep with their lips together.
Right.
So that's what it is. That's all it is.
And our diet is quite soft, especially in this country and the US, I suppose. The sort of the diet these days, especially with fast food, processed foods, it's all very soft. If you're not on a very whole food diet, then you're not getting much work in the jaw in terms of chewing there. And were you just saying that has quite an effect on how your muscles in your face develop?
Absolutely, it's profound. I mean, what I think is that the diet, especially post-industrial revolution, when things started to become ubiquitous and easy to get, and mass production of sugars and wheats, and everything started to become processed. So what happened was, one of the things that happened was food became softer, because if you think of pasta, for example, pasta's soft, and I'm not saying that they never used to eat pasta before, but it became more ubiquitous and easier and more refined. And if you think of breads became more soft. Like I remember we got some we get some ancient grain, like some camel, which is like thousands of years old, and it's harder, grainier, and when you chew on it, you get a workout from just chewing on the bread. But if you eat like a lot of the refined breads, where it's a lot softer, so you're not getting those kind of workout. And a lot of times, back before the Industrial Revolution, there was a lot of hunting. And there was a lot of the food that you get that day would be the food that you would eat, and you'd eat all of it. Right. And you wouldn't leave anything behind. Even the grizzly fat on, you know, I'm like, sorry to the vegans out there, but if there's grizzly fat on the meat, they'd eat that. They wouldn't leave that behind. There was respect.
Right.
There was more respect to the food back then than there is today.
So we haven't necessarily developed for the better then, in some ways, in terms of evolution, I suppose. We haven't necessarily... I think we're almost struggling to keep up, right, with the way the world is developing these days. It's like our body is sort of being left behind.
I like to call it devolution.
Devolution. Oh my goodness.
In the past.
I have heard that term before, actually. I think James Nestor's book, Breath, he mentions devolution.
Yeah, I'm yet to read James'
book. Oh, it's fantastic.
So I do say that because what happens is that, you know, our genetic potential is not being reached.
No.
And, you know, epigenetics plays a massive role in the development of us and animals and whatever living creatures there are. And that means that there needs to be environmental influence for us to reach our genetic potential. Amongst them is the type of food that we eat. Right. And we need to have food that's hard to chew. And when you look at like the structures of craniums of people before, you know, when if you look at the 500 to 1,000 years, you don't even have to look that long ago, and you'll see that their heads were bigger, their craniums were thicker,
right.
Their maxilla was bigger. They all had, like a lot of them, the vast majority had their wisdom teeth, unless there was some trauma, or there was less congenitally missing teeth, which is something very strange that we see today. Like there's like your children are born without, like my daughter's missing some teeth, and so there's a lot less congenitally missing teeth. I don't know what the correlation is, but that's from what I look at.
But they have better teeth than us. Is that?
Absolutely, yeah. And
thousands of years ago.
You know, if you went 500 years ago, like if you went back 500 years ago, you'd think, wow, these human beings, they're good-looking creatures. They're amazing-looking creatures.
Isn't that fascinating, though, in terms of what deems someone as attractive? That actually, if you really think about it, because you make that snap decision in less than 5 seconds, right? If you're walking down the street, let's all be honest, and you see someone walk past, instantly you deem in your mind whether that person is attractive to you or not. But rarely do we ever question what actually deems them as attractive. And I would suggest maybe, as I don't, of course, and I'm sure there's plenty of I don't know if you can prove this in a way because it's so individual, but is it more actually that attractiveness is an image of health, of how healthy someone looks within themselves? And if they're a nasal breather, if everything is more in alignment, if they have better posture, does that deem them a more attractive person? And if their face is structured the way humans are supposed to be structured, then that's surely going, especially from childhood, it's going to develop a more well-structured face, which doesn't that deem them to be a more attractive person? What's your opinion on that?
Well, there's been some studies that have come across that.
Really?
Yeah, for sure. Like especially in the psychological literature, where it looks at symmetry, and symmetry is a massive part of attractiveness. So that's one thing. Right. And the other thing is there are different ratios of, measurements around the body that automatically finds, attractiveness. And that is connected to, obviously, how well you keep your diet. If you're overeating or if you're not, then you lose those curves and things like that.
You're eating hard foods, I guess, too, right? Are you going to have would you say you have a more defined facial structure if you have a diet of harder foods, or is that?
Yeah, I would say so. I would definitely say that's a contributing factor, because what happens is that the moment you start eating harder foods, then you're working the muscles the way they should be.
Right.
And, you're working the muscles of mastication on left and right. Now, you should be eating left and right as well, quite even. Once you do that, you start developing your jaw better. And it's like, with every muscle in your body, that the more you work it out, the bigger it gets, and the underlying bone gets more dense and stronger. It reacts to it. So we know that, like, if somebody has osteoporosis, you send them to the gym to try and do some kind of
or to a personal
weight-bearing
trainer
exercise,
Yeah.
right? Because what happens is that when you work your muscles out, then the underlying bones start to calcify and become a bit stronger.
Right.
The face is very similar to that. Like if you work out the muscles, then the bones react and they grow those, and that's the idea, especially early on. The earlier on, the more it's and I've seen it like so many times. There was one, I'll never forget this one case where I had this young lady. She used to attend the clinic for quite some time, and she disappeared for a couple of years. And I saw her a couple of years later, and I noticed now there was no measurements there, but I noticed the difference in the width of her maxilla.
Right.
And I was like, well, what's going on here? And I had to keep questioning her.
Right.
And eventually she said, well, she got a job modeling somewhere in Scandinavia.
Mm-hmm.
And I said, well, okay, so how was it? How was the job? And she said, well, I got into drugs. And and then it all sort of clicked to me. I said, well, so how long did that happen for? And it was for pretty much, she was just coming off it when she came to Australia.
Right.
And then, so in that period of time, I suspect that she would have started mouth breathing when she was asleep, because when you're under the influence of those things, your breathing changes.
Does that go for alcohol as well?
Alcohol as well, yeah, for sure. And then she had what I would have thought was some contraction in her maxilla. Now, obviously, I didn't have impressions to test before and after and all those kinds of things.
But you could see it change.
But I could visually see a difference. Now, now that's somebody going from a really nice maxilla to like slightly narrow. But she developed good from a child. Now, if you're a child and you're breathing through your mouth early on, you don't get a chance to develop the way you should, and your face undergoes, changes that, well, it doesn't grow to its full potential.
So it creates adaptations that aren't advantageous for the child and for the child's function as well, I suppose.
That's right. I mean, you think about the tongue, it should be in the shape of your maxilla, that top bone.
Right.
And that's what, like, if you look at the arc of it, when somebody's developed really well and their tongue goes up the roof of the mouth, that tongue fits perfectly on the inside of those teeth. And the arc of that maxilla is very similar to the shape of the tongue.
Wow.
It's no coincidence when you see that. You see that, and look, there's a lot of literature out there. There's a lot of studies out there that are coming.
I've read a paper too, with the tongue, where if the tongue develops in the correct position, then the jaw's going to develop in the correct position, then the airways are going to open up, and it's going to just make life a hell of a lot easier for that child growing up, right?
Well, that's right. And like, you think the base of the nose is the roof of the maxilla. So the nose is, if you look on an x-ray, you can almost see some of the teeth going up in the base of the nose. I mean, it doesn't enter it. Obviously, it's protected by the bony structures and the sinuses or what have you.
Yeah.
But they're very closely related. And once the maxilla widens, then the nose tends to go to where it should as well. And there has been even some kind of speculation that when you get a deviated septum, which is like the bending in the nose, that there could be some correlation with the underdeveloped width of the maxilla. They have tried to do it in reverse, expand the maxilla to see if that deviation, and it doesn't go away. But I would think that if your maxilla tends to go to where it should early on, then that deviated septum, I would think that it wouldn't be anywhere near as bad.
And does this decrease then a child's chances of needing braces and needing orthodontics in their sort of teenage years and everything like that?
Well, yeah, I would say, like, when you look at children especially, and if you look at a child who's been nasal breathing all the way, and a child who has good habitual tongue elevation habits and eats well and has good posture and all those things, you tend to see that these particular children have straighter teeth.
Right.
And that's one point. The other point to make is that crooked teeth tends to be a modern condition.
Yeah.
So if you go look at like a couple of 100 years ago, and Western price teeth is, everybody knows about these like nutritionally physical degeneration. Where he took all the photos, quite some time ago, turn of the century of indigenous populations, and compared to those people who ate food that was more refined and had sort of Western kind of influence.
Again,
and
that chewing,
them,
right?
And found that they had straight teeth, that chewing and a nasal breathing, and there was less possibility of getting allergies and inflamed adenoids and all those things that make you open your mouth. And he found that they had straighter teeth. And so that was only one of the things that he found. There were other things that he found as well, but that was just one of them. Right. So it's interesting. You ask me, does it affect your teeth? I would say if you look at the retrospective, information out there of our ancestors, our recent ancestors, then you would find that they have straighter teeth, especially before the Industrial Revolution.
Yeah.
And the difference, I would say, is our change in modern lifestyle, including refined foods.
Yeah.
So I would say, there is a difference. Yeah.
Wow.
But how can you? It's such a difficult thing to intervene. It's such a difficult thing and it really takes a lot of effort on the parents to intervene really early to get these kids sort of on the right path.
In terms of that, how quickly would you advise that a parent puts their child onto solid foods? Because I think quite a lot of parents leave it quite a while, right? They start them on very, very soft foods and very slowly introduce their children to harder foods. So how quickly did you introduce your daughter, for example, to solid foods to get her chewing?
The thing is, children tend to know, I think, but when they're ready to start eating. Mine was quite young. And
really?
I'd say she was a bit over 1.
Whoa, so early.
But the thing is, there are kids that start earlier, some start later. I don't really know what the correct answer to that is.
No, maybe there is. Maybe it's very individual.
Yeah,
that's true.
But the one thing I do know is that when they start eating, it's best to try not to. I don't agree with putting a spoon in a child's mouth too early, because I think that can intervene with the elevation of the tongue to the roof of the mouth.
Oh, that's interesting.
I think it's to use clean hands, of course, but sometimes get them to hold whatever food they have in their hand and start nibbling and chewing on things.
Right.
I think that's how it was. Look,
going back to basics, right? And this is something I said in my first episode as well about. I mentioned a Philip Shepherd quote. Actually, it's bringing clarity to a chaotic world in terms of just coming back to basics. In that actually, maybe it was a little better when it was simpler. Maybe because we're not even complicated. Humans aren't that complicated. They are if you really break everything down. But in the black and white, the grand scheme of things, they're not that complicated. If everything is
when we look at
if everything's good.
Yeah, well, when you look at what we need as human beings,
right? That's what I mean in terms of we're simple.
We don't need much.
No,
you don't need much food. You don't we overeat, and the idea of when I grew up eating 5 times, three main meals with 2, making sure that you have tea before you sleep and snacks between all your meals and things like that. I think we're overeating. That's one thing, and we're we don't need to in terms of exercise. If we're just out and about as children playing outside until when I was a child until the sun came down, I don't do that anymore. They're in front of the computers and they're sitting there playing until late at night.
And that's going to encourage that posture too, right? That mouth open, that forward posture.
Yeah. So it's all kind of interconnected. So if the basic needs is just eat well. Hippocrates when he said, let the food be thy medicine, that kind of thing. And so just do the basic stuff and don't overcomplicate it. Sleep well. Make sure you've got some spirituality in your life. And regardless of what your belief systems are, have some spirituality in your life.
Have some hope, right? That just have some
hope and try to have a positive outlook and then we're talking about breathing, right?
Right.
Learn to breathe through your nose. Learn to have the correct sort of breathing mechanism. And if you do those things, then your body kind of will reward you for it.
Yeah.
You imagine, like, if you had to think about all the tiny little things that are going on in your body, you go crazy. You don't know what's going on in one cell in your big toe. You go nuts, right? You don't have to, but all you've got to do is just treat it like a sacred machine and give it what it needs.
Yeah.
But don't give it too much, because it will ask for more if you keep putting stuff in there.
Right.
And if you treat it like that, it will reward you. And so we're talking about, like, breathing. We're actually making it breathe less.
Breathe less. Less is
in
more.
This case is more, 100%.
Less is more, and keep it simple.
Keep it simple. 100%.
What a relief. What a relief to hear, with so many, I don't know about you, but how many adverts do we see every single day of an expensive health fad or a new diet or a new gym subscription or something that's going to up-level your health, but at the cost of $100 or whatever? What a relief to know that we have that power within ourselves actually to come back to basics and up-level our health on our terms, and bit by bit making those small adaptations. That's I feel so calm and so grateful just to hear that hey, if you just do what your body was made to do, it's all going to be good. Don't mess with it.
Don't mess with it. That's so true. And the thing is, imagine if you was a multi-million-dollar pharmaceutical company who was trying to work out a way of commodifying nasal breathing, then all of a sudden you'd be seeing billboards everywhere. Right. And okay, this is what you got to do, but put $1 coin here or whatever.
Right.
I guess what I'm trying to say is that nasal breathing is one of the best and healthiest things to do. And like you said, it's free. It's free. It's like getting early morning sunlight in the morning. It doesn't cost anything, and it's worth the world. So you're definitely on a winner there when it comes to that.
But then it's available to anyone and everyone on the planet, right? It doesn't matter who you are. It's literally, if you're a human, you have that capability to be at optimal health. Of course, within reason. Of course, there are some people that have disruptions within their bodies, but on a general sense, that's a really empowering thought. Also, to think that parents can have that sort of knowledge for their children, that simply by encouraging them to close their mouths, they can help a child develop in a better way throughout their life. What an incredibly empowering thought. And I think this information needs to be out there as much as possible, right? This could have impact so many lives.
Well, I totally agree. I think that if the more people that learn about it, and we're not actually saying anything new.
No.
And that's the thing. We're just sort of pointing out, like, that this is the human body, and the human body is made to do this. So do what it says to do. Yeah. So we're not saying, oh, okay, look, you know what, we've got this special idea of how to make you
this new 2020 nasal breathing.
Actually going back to the past
thousands of years, right? And this is the thing, is that for anyone listening, is that this is true. Neither of us are saying anything new. These ancient practices, these nasal breathing and slow breathing and chewing solid foods, people have been reaping the benefits of this for thousands and thousands of years, but it's almost something that we've lost and started to lose in the rush of modern day life. And so, I think that's really important to point out, that this is nothing new, but now we actually have the medical and technological advancements to prove that, and to show people on paper in a scientific way how actually incredible these advantages are.
Yeah, I totally agree. And the more people that know about it, the more people that empower themselves, then, we could hopefully there will come a day where you and I walk into shopping centres and we don't see anybody mouth breathing anymore. How good would that be? But
right.
I would say like at least 1 out of 2 people. And you're like, oh no, oh no, oh no, oh no. Okay, he's good, she's good.
Yeah.
So that's what happens.
Oh yeah, when you start noticing actually, and when you become aware of the difference of nasal breathing and mouth breathing, you start to see it everywhere, especially when I see people running. And of course, I know it's much, much harder to make the switch to nasal breathing while running. That does take time. That's a journey. But if you're willing to go on the journey, the benefits are enormous. But I see so many people running with their mouth wide open, and I just think, oh, that cold, dry air, that it looks painful. The running looks painful, you know?
One thing you can do, like if you're finding, you're just starting out to do exercise and you're finding it difficult to maintain nasal breathing, just slow down.
Yeah.
Like sometimes if you just
Again,
slow down.
Slow down, guys.
Slow down. Yeah. And if you just did that, if you slow down just a little bit, then because it's like a machine, right? And you're just sort of getting yourself used to that slightly elevated carbon dioxide, which you're unfamiliar with.
Yeah.
And doing that long enough means that the next time you can go, you might be able to go a little bit quicker and eventually get to a pace where you're comfortable and you're doing a quicker sort of run, but you can tolerate the increased levels of carbon dioxide. You can't do that overnight.
No, and if you can't run, walk, right? Literally, don't run before you can walk.
That's right,
If anyone's listening has been inspired throughout this podcast to start looking into and making the switch to nasal breathing, which it really is that easy, right? You quite literally can just close your mouth right now and start breathing in and out of your nose. But you don't need to run a 5K straight away. You can absolutely just go for a walk.
1 step at a time.
One step at a time. And it is a journey. And it's a much smaller space, so it can be a little uncomfortable at first, of course.
Yeah, 100%. 100%. That's the end goal, I reckon.
Yeah. So just to finish, I really, really want to talk a little more about MYOSPOTS, just to let everyone know what they really are. So would you be able to quickly explain how MYOSPOTS came about, what's so amazing about them, and what you actually do with them, what they actually are? I know we've explained ever so slightly briefly that it goes on the roof of the mouth, but just to let people know, and I know there's some special things about the ingredients, and everything. So I'll hand it over to you to tell everyone.
Yeah, sure. Well, look, MYOSPOTS was an idea that a friend and I had, Ibrahim, to try and find a tool that we could use to help people empower themselves, to train themselves to have habitual tongue elevation and nasal breathing. And originally there was a product out there that wasn't intended for use to be put in the roof of your mouth because of the ingredients it has, but also because of the use. It was supposed to be used around stomas, which is like, imagine somebody has, for instance, an operation where they need a tube or something inside their body. And they need to sort of seal around the end, around the edges and things like that. And so I found that they used to use it, and a lot of the therapists out there used to punch holes in them and get little circular spots, which was actually a great idea.
Right.
It
had a good intention behind it.
The intention was great, and the product actually has helped a lot of people.
Right.
But I found that when I was about to use it, I did some research and I found that it had some synthetics in it, and it also had some most of it was porcine, which is made of basically pig gelatin. And the issue I had with that was that, okay, look, this is not going to work for vegans, for Muslims, for Jews, and for anybody else who doesn't. So and I work at a holistic dental practice, so I couldn't really offer it because all my patients do a lot of research on all the products that we use.
You want to know what they're putting in their bodies, right? Quite rightly.
And then, so when I spoke to Ibrahim, he's got a PhD in pharmacy, and he specializes in drug research and things like that. And and I explained to him what we wanted to do, and he managed to be able to come up with a formula, not just that, but a way of developing it. And so the things that I made sure that were in the product that had to be natural. It couldn't have any animal product. It couldn't have any synthetics in there, and it had to be something that was food grade, so something that already exists. And so basically it was a combination of different hydrocolloids, so things like agar and xanthan gum and plant cellulose and things like that were already in existence for many years and have been proven to be safe and good. So that was the first step. We had to make sure that the flavors were all natural, and so the colors were all natural. And that way we managed to do that and manufacture it at a first grade pharmaceutical company in Switzerland.
Amazing.
And that's how it came. And the idea is that these little spots, they stick to the roof of your mouth.
Shall I show people?
Yeah, sure. Has yours dissolved already?
Yes. So I'll put another one in. And then could you tell everyone, so when is the best time to do this, especially because is it that you're not supposed to talk while you have it in, or can you talk, or like should you avoid?
Yeah, sure.
So I'll try and it's tiny.
So yeah, very tiny. They're like
there we go.
6 mils in diameter.
Yeah.
So they're very small, and they should be like 3 mils behind your 2 front teeth and the gums there. And you just push it up there for like 10, like you count 10, and then you slightly wet it with your tongue. That's what I find. So rather than putting your tongue straight up there, just put a little bit of saliva on it to wet it, and then you place your tongue up there. Otherwise, it'll stick to your tongue and your palate, and then when you pull your tongue away, it will pull it off. So you try and wet your tongue first. And once it's up there, it won't dissolve unless your tongue's up there. So you're pretty much, if you're ignoring it there, it's just going to dry out. So you have to if you want it to disappear, unless you go in there and pick it up.
You have to put your tongue up there.
You've got to put your tongue up there, and it will dissolve after about 45 minutes.
And it tastes great. So every time my tongue touches it, I get a little blast of blueberry, which is lovely.
Yeah, so that's cool, right? So you get some antioxidants there. I'm assuming that they're all natural, the flavors, so there'll be some residual antioxidants from the blueberry. And then so once you do that, like after it completely dissolves, you get the right amount of tongue training to elevate your tongue through your mouth, and you should be breathing through your nose all along as well. So you do that, we think around 2 to 3 months, and you should be able to develop the habit of nasal breathing. You can fast track it. You can put 2 a day and do that for like
say, how many a day do you sort of advise is best if you really want to see change?
I would say twice a day for a couple of months. That's a really good period of time that you could sort of really give it a good knock. And try to do it, like if you're an adult, try to do it at times when you're driving your car or something like that, where you're concentrating. You'll find that a lot of people that do it will be like, I never realized that I usually play with my lips or do other weird things. Some people bite their lips or something like that.
Right.
And all of a sudden they can't do that anymore because their tongue's up there and they're preoccupied with it. But they realize that that's what they used to do.
Right.
So you can still drink with it. You can have like water and things like that. It's probably best not to eat while it's in your mouth. Just wait till it dissolves. And probably don't do it too close to your sleep, because you don't want to sleep with it and it's stuck in the roof of your mouth, because you don't want to end up swallowing it or anything like that.
So for kids, is it great if they sit down to do some homework, and then so if they're distracted doing that homework, they're sort of subconsciously having their tongue in correct alignment as well? I wonder if that'll help with focus too.
So there was one study I read a while ago about chewing gum, and for some children that improves
and university students too, not just young children. There's a lot of people that need to concentrate and they pop some gum in and they start chewing.
But I don't know, with MYOSPOTS it's a little bit different. There's a tongue movement instead of the muscles of mastication. But there is a possibility that it can help with focus maybe. I do know for a fact that there is one study out there that showed that there's an increase in bodily strength when your tongue is elevated. So if you just raise your tongue to the roof of your mouth, you get like a 30% increase in. This study was about like thigh muscle strength, and it's quite amazing.
That's amazing.
So there is some kind of connection with it, and I don't really understand it yet, but there's a connection between the neurology.
More research.
So, but it does make you stronger. It just goes to show you that that's where your tongue should be. So Yeah, and just doing that for like that period of time, once you develop the habit, then hopefully you maintain it.
Right.
And
Yeah.
your tongue should be there all the time. So you should be able to maintain tongue elevation and nasal breathing. Now, if you're like a habitual mouth breather, you may want to try and tape your mouth at night for like, a few
I've
weeks
been
as
taping
well,
my mouth at night for the last 2 months or so, and it's really helped, but I'm not ready to. I think I left it off for one night and I found I woke up with a bit of a dry throat. So it's still a process and still it takes a few months.
And that's got a lot to do with the position of your sleep as well. If you're sleeping on your back or on your side, and a lot of those things can affect. I think a lot of people who sleep on their back tend to drop their mouth a little bit during sleep and things like that. But,
right.
So that's MYOSPOTS in a nutshell, really. So it's the idea was to create some intervention that was easy and accessible for people to use. So you could just, like you were saying, empower yourself and be able to do it without having to go through a massive process of retraining. Now, I'm not against any therapies,
right?
But being able to make it sort of accessible to everyone was one of the goals, so that we could get people that if somebody didn't want to do like a whole bunch of therapy and they just wanted to focus on getting their nose working, because there's connections between mouth breathing and ADHD and like things like that where you can sort of there was one study to show that the prefrontal cortex oxygen deprivation in mouth breathers.
Wow.
And
that leads to anxiety as well, possible so many mental effects.
So there's like, once you've got like a lack of oxygen there, and you just got to know that your brain's not functioning 100%.
Right. You're unfocused, then you're agitated, etc.
That's right. So once you start, and that was basically it. So the two things that we were looking to try and fix was nasal breathing and tongue posture. Both of those together. We see that tongue posture is a really important part of the whole system and sometimes neglected. Right. So having the nasal breathing is really important and great. The tongue posture is also very important as well. Doing both together, you get like.
And where can people find MYOSPOTS? Where can people get them? I know you have an Instagram account, so definitely give them a follow on Instagram. It's just @MYOSPOTS, right?
That's right, yeah. So on the website, so on the Instagram page, you'll be able to see the website. It's myospots.com.
Right.
But I think we also got like some in the US, we've got Myo Made Easy. It's myomadeeasy.com.
Nice.
So there are two main, and they're the main two places. And there's we also got a couple of guys here in Australia. Dental Plus is one of the other guys that have in Australia as well.
Awesome.
So, and who else is there? I think Smile Boosters, yeah.
Oh, cool. So what's next for MYOSPOTS? What do you see happening? How mainstream do you think this is going to be? Are we going to see it popping up in all of our pharmaceutical stores and everything?
Perhaps not so soon.
In the next few years, maybe?
Yeah, maybe. I think that the biggest thing now is to try and, our goal is to educate more professionals.
Yeah,
because we feel
dentists
like
and things.
Dentists and speech pathologists and physiotherapists and osteopaths and doctors and ENTs.
Oh, wow.
Our goal is to try and educate them as much as possible, because it's one thing to educate, and we definitely want to get it out there to the general public for sure. But we feel that if we educate a lot of the professionals, then that will trickle down to the rest of the community.
And people are informed, they have the knowledge, they're not just picking it up sort of by accident. Yeah. It's with intention. That's smart.
That's exactly right. So that's our primary focus for the next year or so. Maybe like in the future sometime we might think about fortifying it with different vitamins and minerals.
Wow.
So
awesome.
For instance, like, you could get a dose of magnesium at the same time as elevation of your tongue, and that will be something that we may look at in the future as well. Fantastic. But at the moment, just speaking to people like yourself and just trying to get it out there. That's
spreading awareness, right? The more people talking about breathing, the better.
That's it. Yeah.
Amazing. All right. Well, just to finish, what are your 3 biggest tips for everyone out there looking to elevate their life in some way through their breathing? I think I can guess what your first one would be.
Well, it's got to be nasal breathing, right?
Yeah.
It has to be. It has to be nasal breathing. So my biggest tips, it would have to be nasal breathing, and
Breathe through your
be
nose.
and tongue elevation. And I would say, look, there are so many, but I'd say number 3 would probably be just have some kind of spirituality in your life. I would say that's really important.
I agree.
Just something like take some time out from the world, meditate a little bit.
Give time for yourself.
If you pray something where you can take some time away, and while you're doing that with your nose.
What an incredible message to finish on. Sorry, I mean, I can't speak very well in this.
No, that's okay.
It makes my voice get funny. But thank you. What an incredible message to finish on. That's absolutely incredible. Thank you. I've absolutely loved our conversation. Thank you so much for taking the time and coming on to speak to me and to speak to everyone listening to the Just Breathe podcast. I really, really appreciate it.
Awesome. Thanks, Joey, for having me.
Thank you so much.
Awesome. Okay.